My name's Hasan Jilaihawi. I'm Director of Interventional Cardiology Imaging at Cedars-Sinai Medical Center in Los Angeles. I've just presented at the International Academy of Cardiology Annual Sessions 2015 in Vancouver, and I presented on the importance of imaging in structural heart disease interventions. So this is a very important area, a focus for a lot of our research at Cedars-Sinai. And essentially in my talk I illustrated the importance of this for several different interventions. We spoke about firstly congenital heart disease and how the focus of that is often guided with MRI to guide complex interventions. And more recently, with our congenital colleagues, we're doing 3D printing. And I moved on to different interventions which require different imaging modalities, so left atrial appendage closure and MitraClip. Now these are procedures that highly rely on transesophageal echocardiography, both for pre-procedural planning and also during the procedure with procedural guidance. Lastly, I spoke about our most common procedure at Cedars-Sinai. We're doing around 500 transcatheter aortic valve replacements per year. This is driven very much so by good advanced imaging, and we're using CT imaging for the majority of patients. We use this to direct anything from vascular access to choice of prosthesis, and it is the most important modality to guide the risk of procedures. I showed some data on how we have dramatically reduced the incidence of life-threatening complications such as annular rupture and paravalvular leak, and this is something that is here to stay. And it facilitates a much safer and streamlined procedure. Lastly, I discussed the value of 3D printing overall and image fusion, and these are things that are very much an area of interest for me, and I'll speak more at the next meeting.